I see that our neck is falling forward. This exercise also helps prevent a Dowager's hump. You might feel pain here in the neck, but the real culprit is the chest muscle. We work on the area between the shoulder blades, improving its strength. You'll forget about osteochondrosis, herniated discs, headaches, and even high blood pressure. Hello everyone, friends. My name is Maksym Mamchur. I'm a physical therapy specialist. I'm also the co-founder of the Kinesiotherapy Center network Healthy Movement. And today we're going to talk about a rather interesting topic, namely the 3 crucial muscles, without which your persistent neck pain will absolutely never go away. Therefore, if we truly don't work on them effectively, there will constantly be increased pressure, osteochondrosis will continue to develop, painful herniated discs may eventually appear, and there will be noticeable numbness in the hands. But once we effectively work on these 3 essential muscles, I can truly assure you, you won't need to visit chiropractors or traditional medical doctors anymore. You'll simply maintain your improved condition with the beneficial exercises I'll show you. So please, don't switch away. Get ready for some really interesting information that you won't find anywhere else on the internet. Let's get started. So friends, what do we usually have? When the pain starts, what do? We apply ointments, or we put on some kind of patch, hoping that it will warm the area, help somehow. Maybe something is pinched and it will go away. That's the first stage. The next stage, when it doesn't go away, is that we turn to some kind of manual therapists, osteopaths, and so on. They relieve a bit of the spasm, the manual therapist does something. We feel better, but the pain, let's say, comes back in a month or 2. Again, in the same spot, we go through the same procedure, but this time we realize that the manual therapist can't help. The next stage is turning to a traditional doctor who prescribes us a whole mountain of pills, IV drips, and maybe we take them. For a while, things get easier, but then the pain comes back, our hands start to go numb, we can't even turn our head anymore, and so on. And we all start asking ourselves the question, why does this happen? Why doesn't it go away once and for all? Friends, the answer is actually very simple. It's because we simply do not eliminate the true root cause, the fundamental initial cause of our persistent pain. With the various methods I mentioned earlier, we are only masking the underlying cause. We get rid of some trigger points, some pain points. We numb the pain with medication, but nothing really changes on a global scale. But what exactly? What exactly is causing this pain? I'll explain now. So what usually keeps bothering us, and why does this pain keep coming back? Let me show you, friends. Most often when you come in for a consultation with these kinds of symptoms and complaints, what happens? I look at your neck and I see the following. I see that our neck drops forward and is, well, maybe not always in this position, but still, it tends to be in a posture where the head juts forward, our shoulders round in, and we walk around like this all the time. Some pain appears, we treat it. With the methods I mentioned, the pain comes back. But what's the main thing? What is the main question? The main question is to return our head to its physiologically correct position. Like this. Open up and broaden our shoulders, return the head to its proper position, and effectively relieve the constant overstrain from those specific muscles that will persistently keep bringing you back to pain, that will inevitably make you keep seeking out every single doctor in the entire world. They will worsen blood supply, cause hernias to develop, and so on. What is this muscle that creates this kind of posture? First, it's the pectoral muscle. Yes, the pectoral muscle specifically. The pain might be here in the neck, but the pectoral muscle is to blame for it. Why? Because the minor pectoral muscle, pulls our shoulders inward, making them rounded like this. And as a result, what happens to the neck? It drops down. As a direct result, we constantly experience significant tension here, specifically in the cervical spine, and we keep trying to hold our head up because of this persistent issue. So first of all, we will work diligently on stretching the chest to help it effectively open up and release. The second muscle is the interscapular area, the area between the shoulder blades. Why am I emphasizing this particular point today? The shoulders have rolled significantly downward, so the muscle between the shoulder blades has become stretched out, quite weak, and has allowed our shoulders to fall forward. Therefore, our primary task is to strengthen the entire interscapular area and also bring the shoulders back into proper alignment. And the third muscle that has weakened is the extensor of our neck. Because the shoulders have rolled forward and the head has dropped down, our large extensor, also known as the splenius muscle, has become weak from constant overstrain. And it also needs to be restored, to return to its original position. So what do we have? We have stretched the chest, stabilized the shoulders, and returned the head to its correct physiological position. Only this approach will relieve constant pain in your neck. You will forget about osteochondrosis, herniated discs, headaches, and even high blood pressure. So, Now grab your mat and let's start doing the exercises. Let's go. Alright friends, the first exercise is to stretch the chest. I place my hand like this in this position on the edge. What am I doing? I roll over onto this arm, my top leg goes back, and as a result, I feel my chest muscle stretching, then I return to the starting position. At the same time, I keep my head up the whole time. I don't rest it on the mat. Do the same with the other arm. 1. Stretch the chest muscle back to the starting position. 2. Repeat after me. 2. 3. Stretch the chest muscle. 3. I add an exhale. The exhale will help stabilize. 4. It will stabilize our blood pressure during this exercise because when a person is doing exercises. 5. While doing the exercises, you want to strain in order to make it easier to perform a particular exercise. 6. And accordingly, a person overexerting himself raises his blood pressure. So, 7. During class, the blood pressure may suddenly spike and we might then feel quite unwell, making it difficult to continue with our scheduled class activities. 8. And literally 2 more times. Plus, this special effective exhalation helps. 9. Helps the muscle to fully relax. So to speak, when I do this particular movement, it's much easier for us to gently lean into the muscle with this added weight and effectively stretch it. But at the very same time, you absolutely need to be quite careful not to injure yourself or potentially overstretch the muscle. That's enough. Let's drink some water. At first, 10 times will be enough. With each subsequent workout, you can gradually add more. For example, 15 to 20 times later on, if you have the physical capacity for it. Now, let's drink some water and move on to the area between the shoulder blades. Okay, the second exercise. We're working on the area between the shoulder blades, improving its strength. What do? You lie down in this position. My lower leg is straight, the upper leg is bent at the knee. I place my hand, which is bent at the elbow, under my head, supporting myself on the elbow. I'm even holding my head up a little. And what do? With the upper arm. 1. Raise your arm up, bring the shoulder blade toward the spine. Time. They returned home with an exhale. 2. And with an exhale. 3. The shovel was raised. And 4. They raised their shoulder blades. And 5. And also more than 6. And 7. I can literally feel my shoulder blade coming closer to my spine. And 8. And 9. And 10, that's enough. Switch hands. And do the same with the other hand. 1, starting position. 2, shoulder blade to the spine. Starting position. 3, really tense the shoulder blade. Just feel how it very slowly now moves closer to the spine. And then 4, don't forget to breathe. We effectively stabilize our internal pressure. We also help our muscles contract and stretch as much as possible through our controlled breathing. 5, 4, 3, 2, 1. 6, 7, 8, 9, 10. Enough. Let's drink some water. Exercise number 3. What are we doing? We strengthen the extensors of our neck. I'm lying in this position, arms bent at the elbows. On the exhale, I gently and deliberately move my head backward. It's very important to carefully guide it back, not to forcefully throw it back, but to smoothly and controlledly move it back. Then slowly and precisely return to the exact starting position. I comfortably rest my head on my chin. 1 and 2 and 3. 4, don't forget to breathe deeply. 5. This beneficial exercise also significantly helps prevent a noticeable buffalo hump, greatly improves vital blood flow to and from the head, truly enhances overall circulation, thoroughly saturates the head with essential oxygen, effectively lowers blood pressure, and most importantly, completely relieves you from the discomfort of osteochondrosis and, God forbid, the severe pain of intervertebral hernias. Hold your breath deeply and make completely sure that you do not forget about it at all. Friends, we perform each exercise for 10 to 15 repetitions. But I remind you that with each workout, we need to load our muscles. Therefore, the number of repetitions can always increase depending on your physical condition and how you feel. Friends, if you enjoyed today's episode, be sure to let me know in the comments how quickly you started to feel better after today's routine. Be sure to subscribe to our channel and turn on notifications so you can be the first to know about useful videos. And we'll see each other next Sunday. See you!